Good morning, this is Dr. Whitfield. I had a consult recently for a patient who was inquiring about a DIEP flap. She had seen several physicians in consultation, both breast surgeons and plastic surgeons, and was not encouraged about having a DIEP flap. She had researched on her own the procedure and really desired a DIEP flap. However, in consultation she was told this would not be a good idea based on her body, based on her abdominal tissue. She also had a history of other surgeries, which were concerning, but I think I'm discouraged by the fact that the patient could not find someone to help them. The patient, being their own advocate, went onto the internet and began a search for patients who performed the DIEP flap. She found me on the internet, and we had a very pleasant consultation. For the past 5 years, I performed the DIEP flap with a great deal of success. We are at a large center. We have a full operating room staff that are very used to and comfortable with performing microsurgery, and have done so for many, many years now. We have a wonderful group of nurses on the floor to provide excellent care after surgery. So we have the full package in terms of your consultation in our office, your pre-op and post-care, as well as the operating room care by a great group of staff and our nurses on the ward who care for the patients afterwards and monitor the flaps for us. So I'm a little discouraged by the fact that the patient cannot find help in their area, but I am encouraged that they were their own advocate and went onto the internet and typed in the DIEP flap and were able to find a surgeon, myself in this case, to help get the procedure that they desired. And at least if they weren't a candidate, be told that by someone who performs the procedure, who's used to performing the procedure, is very comfortable performing the procedure. I would encourage everybody who is not comfortable with their consultation to go seek another consultation. It's not offensive to the people who have provided you the initial consultation. It's important for you to feel comfortable with who's going to provide your surgery, whether it's your breast surgery or your plastic surgery. If you don't feel comfortable, you should seek another consultation. It's perfectly fine. And that's essentially what this patient had done. And I admire her ability to seek out what she desired and press on. It's very discouraging when you have to deal with whether it's active breast cancer or something like DCIS, where you're going to have surgery. It's not to deal with, and it's discouraging when you don't get a comfortable feeling with the professionals who are trying to provide your surgical care, whether it's your breast surgery or your plastic surgery in terms of reconstruction. So I encourage everybody to use all resources available to find the best available options for their situation.